right, we're in the final minute of 2025. We believe there's about to be a countdown. We don't know. That's my wife. 2, 1. A 3, 2, 1. I was expecting a 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. But we're in St. Louis, so we are celebrating with some Nelly in the background.
Yes.
So it's only appropriate. Someone's bringing the fun. Peace. All right, back at it. As you can see, I went out for the first time on New Year's Eve in probably more than a decade. My wife and I went to dinner. We stayed and rung in the new year, and we're promptly home at 12:30 a.m. But it was fun to get out off the couch, although it was a little different for us. So again, Happy New Year. Today I wanted to go over some of my thinking around both my metabolic and my physical health goals. And also, I think I have a secret weapon for you, and I want to help you deploy that. Each year when I set goals for the year, I try to think of the areas of my life I want to evaluate and improve on, from like my relationship with my wife, to my relationship with my kids, to my friends, my learning goals, professional goals, business goals, so on and so forth. And as it related to health the last few years, I think I had a number of different goals. I think of the 10 goals maybe I had kind of set out to achieve at the beginning of the year, like 5 of them were related to health. So this year, I'm thinking about it a little bit differently. I'm thinking about it in the sense of how do I want to look on the outside, like physical health, and how do I want to feel or look on the inside, like my metabolic and maybe cardiovascular health. So today, that's what I want to break down for you, and kind of what those goals are for me this year. And then more importantly, like what are the drivers, the inputs, and the systems I have in place to track my progress. So let's kind of dive into that. All right, so let's just start by breaking down my physical health goal for the year. So I know my brain, I envision what I want to look like at the end, by the end of 2026, hopefully sooner than the end of 2026. And it's just a continuation of my 12-week focus to kickstart this year, where I'm trying to get leaner and reduce my waist circumference to improve my metabolic health. So that's where I'm going. I have picked out 3 metrics that I'll be tracking this year. Later in the year, I'm going to do a repeat of my Sika body composition test, which I first completed in December. My percent body fat was like 22%, and my goal is to get to 18%. My weight is currently like 191, 192 pounds. I want to get to 180 pounds. And then my waist circumference is currently 37 inches at the time of this recording, and I want to get to 35 inches. So those, I know that combination of those 3 metrics and what I envision, how I envision that I would look with that, I've been there. I've been there in September of last year. If you've watched the previous video, you probably saw that picture. But that's where I'm going from a physical standpoint. Those are my goals. From a metabolic standpoint, I want to reduce my hemoglobin A1C, which again is like a measure of my glucose control over the last 3 to 4 months. So currently it is at 5.6, which is just below the threshold for being pre-diabetic. I want to back that down because I'm at risk. I want to back that down to 5.4 or less. Another of the measures that I'll be tracking for my metabolic health is my visceral fat, which I actually had measured with my Sika body composition assessment in December. So I came in at 2.1 liters, which is a good result. But I want to, if you can push it less than 2, then that's like in the optimal range. So I'm actually going to push for that in the 1.5. At 1.5 liters is my goal there. And another measure I'll be tracking is my ApoB, also called apolipoprotein B. Hard for me to say when I'm recording this. And that's just a measure of like the damaging cholesterol that is circulating in your blood. So I want to be reducing that. I did reduce it last year from 95 to 65. That largely was due to me starting a statin. I started Lipitor 20 milligrams back in April. But I had made some progress on that with diet, just by cutting back on some saturated fats. But that's another measure that I'll be tracking from a internal standpoint. Something you can't see looking at me, but the hemoglobin A1C, apolipoprotein B, and then my visceral fat. Those are things I'm monitoring this year with lab draws and this with a Sika body fat composition assessment. All right, so before I get into my inputs, they're gonna be driving my results to those goals, I wanna pause for just a second to encourage you to think beyond just, I want to lose weight, I want to lose 20 pounds, I want to run more this year, I want to eat better. I want you to think beyond those and think about setting some goals, even if it's just having a physical or talking to your doctor at all about any lab assessments that might need to be done to evaluate your metabolic or cardiovascular health. Those are things that I want to talk about on this channel. There are probably other things that could be impacting your life or that you have in your family history, but I encourage you in the next month or so, talk to your physician, schedule a physical to have that discussion about any assessments for cardiovascular or metabolic health. Maybe you're in great shape there, but I guess this is a plea for me to encourage you to have it front and center of your life. With that public service announcement past us, I want to dive into the inputs that I've selected that are going to drive my results to those goals. All right, so my inputs from an exercise standpoint, I've simplified this year. So there's 3 things I'm going to be focusing on, starting with zone 2 training with walking. So my goal is to walk 1,000 miles in 2026, like intentional miles where I'm setting out on a purpose to do zone 2 training. It doesn't include walking to the grocery store or going to the mall. It's like I'm going out with my wife and or my dog or by myself to walk at a good clip because I know that this is kind of what I need from, it will impact my visceral fat, it will impact my metabolic health with my glucose control when I walk after meals. And so I know that 1,000 miles basically breaks down to about 20 miles per week. This past year in 2025, I walked about 20% less than I did in 2024. So I was walking about 14 miles or 15 miles a week in 2024. And it was like less than 10 miles, right at 10 miles, I believe, per week in 2025. So I stepped back there this year. And that's something that I know this is actually probably my key focus with exercise is walking. And we'll be doing it again a couple times a day, probably 2.5 miles a day most days, and there we'll have some longer walks in there as well. That's probably my number 1 focus is walking in zone 2 cardio. Second area of focus is with resistance training, and I'm committing to 3 resistance training workouts a week, 45 to 60 minutes each week. So in 2024, I actually probably lifted the most that I had in a number of years. Last year, I majorly stepped back, especially after from July on when we had sold when we moved to St. Louis, we sold our dumbbells, which I could have done some bodyweight exercises, but really for a period of 3 months, I really wasn't doing much resistance training at all. Before that, when I wasn't feeling that great early in the year, I was also not lifting. So it was probably one of the biggest things I missed last year that I'm excited to dive back into, but I'm trying to do it in a manner that is very manageable. And again, to walk 20 miles a week, I can't be doing 5 days of resistance training throughout the year. So I believe that 3 days of probably mostly total body workouts on 3 days, I'll probably mix some weeks up and do 1 day of heavy legs and 1 day of heavy upper body and then a day of total body. But I'll be focusing on 3 days a week of resistance training. Again, this is going to drive my metabolic health through having, when you have more muscle, then you have a bigger reservoir for glucose to be taken up to. So it should lower my glucose. So that's one of the main reasons I'm doing it. And again, with my focus on metabolic health, that's one of the best things that I can do for that. My third area of focus for exercise is to do 1 interval training per week. Probably be on a treadmill, might be on a bike when it gets warmer out, but essentially getting my heart rate up, letting it recover, getting it up, letting it recover. And this is specifically to work on my autonomic nervous system dysregulation that we believe is what's kind of causing some of the symptoms I've had for about 10 to 12 months. So that's kind of doctor's orders to work on that. Plus, I think it's generally speaking a good idea and recommended to have some HIIT exercises or some exercises that do get your heart rate up beyond just zone 2, but not having to do it very often. So those are my 3 areas of focus for what my week of exercise will look like. Again, 20 miles of walking per week, that's focused walking, 3 days of resistance training, and 1 day interval training. All right, my inputs as it relates to food and how I'm going to be focusing on food to reach my goals is I am committing to taking a food journal for 300 days in the year, essentially 6 out of 7 days per week. I have a remarkable tablet that I'll be writing on, or I have the app for that as well. Also, I will have a ChatGPT, a specific thread to just document what I'm eating and then review the output of that food journal, because I think there are some things that I'm probably underestimating the amount of calories that I am eating throughout the day. And I honestly have never been really good at knowing my macros, how many carbs, how much protein, how much fat I'm eating. I'm probably overeating some fats, and I probably am under consuming some protein. So that's an area where that's what I'm focusing on, and I'm gonna evaluate that and learn from it so that I can then begin to make any adjustments based upon how I'm feeling and how my results are going. So that is the input from a food side of things, is just to take a food journal that I am putting thought into and evaluating, not just writing it down, but then just making connections for what's working, what's not working. And that's the only food input that I have for this year. Other inputs that are going to impact my results are, again, my commitment and focus on sleep and quality sleep. So in the past few years, it's crazy. I think I've been within like a few minutes on the average number of hours I've documented as far as sleeping with my Oura Ring. It's been like 6 hours and 40 minutes. So I want to get that to over 7 hours. I tried that last year, didn't get it done. It was about the same thing. So I need to move the needle there. And not just the 7 hours, but again, my focus on my resting heart rate, ideally being less than 52, and then my heart rate variability being above 40, which those are both goals for my 12-week focus. I want to continue to focus on those. The main driver here for all of my impact on sleep will be my nighttime routine and how much food I consume after 6 or 7 o'clock, and that's really a big focus there. It will have an impact on my diet and my food results as well, but really I'm thinking about it from a sleep perspective, is how can I bring some discipline to my nighttime routine many days of the week to get quality sleep of 7 hours or more. All right, the last input I want to talk about is just stress management. Improved stress management will improve my sleep, it'll improve my metabolic health, cardiovascular health, and then in the grand scheme of things, my performance. If I get all those things in line, I'm gonna have better performance. So from a stress management side of things, in the past, I have tried to meditate in the morning. I really suck at it. Maybe I didn't give it a good enough college try, but what has worked for me, I really do consider meditating, or even I think the Huberman Lab podcast calls it non-sleep deep rest, was not each day, but probably 3 to 4 days a week, I take like a 20-minute nap where I set an alarm, I lay down on the bed, I cover up with a blanket, and I just do my best to fall asleep. There are some days where I truly do fall asleep, and there are others where I am relaxed and I don't really fall asleep, but I wake up, or I get up, or I finish the exercise feeling refreshed. So that's something that has worked for me. I will probably continue doing that. What I'm working on now is just daily breathing exercises, like box breathing, where you breathe in through your nose, hold it, and then breathe out slower through your mouth. Actually, I'm working with a coach at the functional health clinic that I go to here, just on the technique for that. There's actually techniques and postures and things I'm working on, and that is something that is a focus for me. 5 minutes a day, and that's an input, a new input to help manage any stress in my life. And so that's something that I'm excited to add to the mix as well. All right, so I shared my ideal results, but what really matters is putting thought behind the inputs that will create the results. That's what I've shared with you. So it's zone 2 cardio, 3 days of resistance training, 1 interval training, a focus on stress management, and document my food and seeing where that takes me. So those are the inputs that I'm focusing on for 2026 to get to my results, to have the physique that I want and the metabolic health optimizations that I'm going after. That's a lot of numbers. Those are a lot of details. So you may be asking, how am I planning to stay on track or measure my progress towards my results and the inputs? So I already have a good habit that serves me well with like a weekly recap and prep for the next week. I usually do it on Fridays. And essentially I look back at each day of the week, pull forward any things that didn't get completed, kill things that don't need to be moved forward at all, and then plan my next week, whether it's putting work calls on my calendar, reviewing the days that when my wife works, putting my exercise, not on the calendar, but kind of planning when I'll be doing each exercise. So that's what I already do. So that's how I will be planning like my walking, my resistance training, review my food journal and such. So that is that part of it. And then as far as tracking, I will have a Google Sheet that will calculate my mileage. I can track my workouts. I'm somebody who likes to have like things documented or check things off when they're actually done. So I'll be leaning on those two things. One, just a habit with my routine, and the other, a tracking tool. All right, so let's get into this secret weapon and how you can deploy it. I truly believe that as you're approaching something hard, like implementing new habits, feeling like crap after your first week of resistance training, or trying to wake up earlier, we're all gonna have self-doubt. We're gonna feel the resistance that comes along with changing habits. And I think you would be served well by even just 10 minutes a day of something to empower your thoughts. So the mental side of health change is a huge component of it. So having something where you can lean into a book or a podcast that's empowering, that reminds you why you're on this journey, what's at stake for you to change, and just has you overall feeling good, it will only add to the process of you achieving your goals. So you may be thinking, great, something else I have to do. Maybe it's new for you. Maybe you're not a reader. Maybe you don't listen to podcasts. But for one, as far as podcasts or books on tape, you can do that while you're walking, while you're exercising. Have a couple of days a week where you substitute out your favorite playlist with a book. It will help you, and it's like stacking habits when you have your audiobook on top of your workout. Otherwise, I would encourage you to think of this 10 minutes a day. Think of it like a framework, like a 10, 20, and 30 framework is something I've thought about in the past, where I know that in 60 minutes, I have 60 minutes to reinvest into myself and my development. So that could be 30 minutes of resistance training, and 20 minutes of walking, and 10 minutes of reading. It could be 10 minutes of non-sleep deep rest, and 20 minutes of resistance training or HIIT workout, and 30 minutes of cycling. It could be 30 minutes of reading. It could be 20 minutes of resistance training and 10 minutes of walking. Whatever it is, you can see how if you're already committing to some cardio or some walking or some weights, and adding in this component will really fuel the fire, I think, for you to be consistent and stay on the right path. So I would encourage you to think of just 10 minutes a day. I know you have 10 minutes. I think you probably will appreciate how it makes you feel, and will see the contribution that it has on your results. So I think that you might go more than 10 minutes, but I encourage you to start at 10 minutes. All right, I want to make it easier for you to get started by giving you a few recommendations to consider. Whether you listen to books on tape or you flip the pages of a book, these are a handful of go-tos that I've gone to. I generally prefer to sink my mind into leadership and health-related books when I am trying to fuel my mind to improve my overall well-being. So some leadership books I like are The 21 Irrefutable Laws of Leadership by John Maxwell. It is a classic. I've read it a few times. I've highly encouraged both my kids to read it. It's like, you've got to read this, right? So that's a good one. Extreme Ownership by Jocko Willink, I think is the name of it. Awesome how it's written it's got like a on the battlefield like situation, and then they work through what the leadership lesson of that is. It's highly entertaining and easy to read. Another one is Choose Yourself by James Altucher. Very transparent book about his struggles and how he ultimately chose himself. So highly recommend that one. From a health book side of things, there are three favorites I have. The first one is Good Energy by Casey and Callie Means. Really gets into the current state of affairs around our medical system, our health system, and how it's really not, it's good at treating acute sickness, but it's really poor at managing chronic conditions like diabetes, heart disease, things that you know I preach about. So that's a really good one. The Obesity Code by Dr. Jason Fung is another really good one that first got me interested in learning about fasting, even in a small capacity, not extreme fasting, and just the role of insulin on how that impacts so many things in our body. So that's a good one. And then this past year, I listened to Dr. Peter Attia's book, Outlive, which I enjoyed as well. So those are some favorites of mine. There's a number of podcasts that are out there you can listen to. There's so many other books, but for my recommendation, those ones I know would serve you well. They've certainly served me well, and people that in my circle of influence, I've recommended those a ton. All right, well, that's a wrap on another show for this season. Thanks so much for watching. If you haven't yet subscribed, now's the time to subscribe. I have a few really exciting things coming up in the next few episodes. Specifically in 2 weeks, I'll be traveling to Mexico with my wife for a kind of a bucket list trip for us, where I'm going to be trying to stay on course at an all-inclusive resort in Cancun. So stay tuned for that one. Many other things coming the rest of this season. And again, if you haven't yet subscribed, I would love for you to be on the journey with me. Thanks so much. If this approach resonates with you, I'd love for you to subscribe and follow along.